the back-to-school protocol this coming fall will be mandatory masks for students in grades 4 to 12. Here to talk a little bit more about what physicians have been calling for as far as mandatory mask use is Dr. Amy Tan. She's an associate professor in the Department of Family Medicine at the University of Calgary's Cummings School of Medicine. Thank you again for joining us, Dr. Tan.
Thanks for having me back.
So we did speak a little while back about many medical professionals calling for mandatory mask use inside. So now we're hearing that the province is going to be asking students to wear masks as a part of this back-to-school protocol. What are your thoughts on what was announced this week?
So I think it is a step in the right direction. Absolutely, we've kind of gone from masks in indoor spaces to, I would say, more of a comprehensive, safe reopening of the schools plan. And masks is just one component of it, and so I welcome the mandating of masks from grade 4 to 12. I would like there to be a stronger mandate for younger ages. I think that developmentally, if we train them over the summer, they can also wear masks most of the time. But also, in addition to that, I think that we still need to be looking at other risk factors to mitigate, such as class sizes, because of the lack of physical distancing that you can have in a crowded classroom. And then also we're learning more about information that we need to look at with regards to ventilation in classes, and really trying to help with, again, a comprehensive strategy to try to keep schools reopened as much as safely as possible.
Now, you're mentioning the age range. I know people have been questioning if grade 4, why grade 4, and so questions around whether they should be wearing them all day, just in hallways, if they can take them off if they're spaced appropriately. Are there still questions then to be answered there as far as keeping kids and their families safe?
Yes, I think there's lots of questions still to be answered, and we will see. It is unfortunately a real-time experiment. I guess I am of the mind, why don't we try to do everything that we think can help mitigate and pull back if we need to, rather than add on. And I think that's my concern with the school reopening plan. I feel like I would rather, as the parent, I would rather go full on with all measures and then pull back. So physical distancing, we're hearing from teachers that it's going to be really hard with desks not being desks anymore, they're tables. And so, in the classroom, I actually think, again, that mask should be the baseline thing in the classroom, because how many times, especially in the elementary ages, are people, the children, sitting facing forward, not talking to each other, where the teacher is sitting quietly at his or her desk? Like, I don't think that happens very often. I have a school-age child. I asked him, and he goes, that doesn't happen very often. So I think we actually, perhaps, again, maybe need to make the mandate or the baseline be the more protective measure, and then if there's specific activities where there's like a test or something, perhaps that would be a place to not wear a mask. And maybe having purposeful mask breaks would be part of the curriculum as well. So there's different ways to kind of look at this, I think.
You mentioned possibly training some of the younger kids. I know I have a little one. I was saying on the program yesterday, she's preschool age. She loves to wear her mask, but sometimes she touches it or chews on it or does something odd. Is it just a matter of the earlier you can try and enforce this behavior? And that's where we're at now as far as, culturally, I guess, with the pandemic, that we just have to try and train our kids a little bit. And the sooner, the more, the better.
Yes, and I think because we're really looking at this pandemic drawing on for a while, like we don't know when the vaccine's going to come and if there's other treatments. And so, yes, so if in the home where it's not necessary to wear a mask, but you start normalizing it with young children, playing dress up with the mask, teaching them how to do it, normalizing behavior like you would washing your hands after going to the bathroom. So that type of thing, absolutely. It's kind of socializing young children to do it. And yeah, they're not going to wear it perfectly, but again, if they get used to it and they start learning, I've had to coach my elementary school child. So it is a learned behavior, but we can do it. We have a few weeks now before schools are supposed to open. Let's try it along with the adults who actually, frankly, have to get used to it as well.
So if you're talking about helping normalize for kids, then even if you have maybe a grade 2 or 3 student and masks are optional, is it something then to consider for parents as they prepare for the fall?
I think so. It would really be nice to have an evolution of that mask mandate to be to the K-3 grades, because we're actually seeing more evidence that the younger children, while they might not transmit it as readily as age 10 and up, and there was that study that was cited yesterday in the press conference, we're actually seeing that the 10 and under age group can still be quite infected. So there was a camp in Georgia where the kids weren't masked, the staff were masked, and there was a huge outbreak, 260, I believe. And a lot of the children, so more than 50% of the infected people were actually age less than 10. And again, part of this is we just don't know. We don't know what the long-term outcomes of this disease are. We don't know what the long-term outcomes for children who get infected are. But then also they can take it home. Their teachers' safety is at risk. Their family members, if they have an elderly grandparent or immunocompromised family member, everybody's connected. And so schools belong in a community, and we have to be looking out for the entire community.
And we last spoke several weeks ago about the call to make masks mandatory in indoor public spaces. Obviously, Calgary has just recently gone that route. The city of Edmonton, other municipalities looking at making mask use mandatory in indoor public spaces on transit. Are you seeing this starting to move the right direction? And what are medical professionals continuing to call for as we move forward into the fall and out of this summer season?
Yeah, so we definitely are seeing momentum. So like you said, Calgary, Edmonton, Banff, Canmore, St. Albert yesterday, Canmore yesterday. So we are seeing momentum. I think though, because so within the province, travel is such a big part of people trying to cope with the pandemic right now, escape to the mountains, go camping. I think we actually need to look at a provincial mandate. There's hotspots in central Alberta. They don't have a mask mandate right now. Could they be aided by that? And so, we're still calling for a look at the province-wide indoor spaces to be consistent. And we're actually hearing from citizens who don't have mask mandates to say, how about us? What about us? Why are we being left, and why is our safety at risk? So now still working on that, municipality by municipality, but ideally it would be from the government of Alberta saying it's for the entire province.
Is that in the medical professionals' opinions? Is that going to be key as we look at whether or not we're going to be preparing for a second wave? I know we're hearing more and more about that lately.
Yeah, so we are still pushing for as much of actually all of Canada to be covered by mask mandates, but provincially, yes, we are still pushing for the entire province to be covered, especially as schools reopen. The number one thing we can do to actually prevent schools from having to close down because of an outbreak is to actually limit community transmission. So that's where, whatever we can do in the community that schools exist in really would help. And masks are, like I said, an added layer on top of the distancing and the hand hygiene.
Really appreciate your perspective as always and your time joining us here on the program. Again, that's Dr. Amy Tan. She's an associate professor in the Department of Family Medicine at the University of Calgary's Cumming School of Medicine.